Hello, I'm Dr. Bhatt, Executive Director of Interventional Cardiovascular Programs at Brigham and Women's Hospital and Professor of Medicine at Harvard Medical School. It's really a pleasure for me to be here at CMHC in Chicago. It's been a terrific meeting so far. We've covered a wide variety of important and potentially practice-changing issues here, encompassing thrombosis, new diabetes drugs, new diabetes trials, lipid-lowering agents, triglyceride-lowering agents, just a lot of coverage of areas relevant to people involved in the care of patients with diabetes, with metabolic syndrome, and even those with just atherosclerosis or at risk for it. One of the topics that I covered was the REDUCE-IT trial. I provided a recap of that study of icosapent ethyl versus placebo. I talked about the main results that showed a 25% relative risk reduction in major adverse cardiovascular events with icosapent ethyl, a 30% reduction in total events, that's first events and recurrent ischemic events. I spoke about the adoption in various guidelines of the REDUCE-IT data and endorsement of icosapent ethyl in the population we studied, which was secondary prevention and high-risk primary prevention. Guidelines such as the American Diabetes Association, the European Society of Cardiology, European Atherosclerosis Society, the National Lipid Association. So I provided a recap of what those particular guidelines say in terms of supporting use of icosapent ethyl in REDUCE-IT-like patients, and then finally touched upon cost effectiveness that has been determined by the ICER group for icosapent ethyl, and they found it to be highly cost effective. Now, coming up several months from now will be CMHC West in 2020. And by then, I hope to provide a recap of what I just mentioned from REDUCE-IT and hopefully more. Well, in fact, I know there'll be more because at the American Heart Association, as two separate late breakers from the REDUCE-IT group, we will be presenting our cost effectiveness analysis. So not the one that was done by this independent group called ICER, but one led by Dr. Bill Weintraub, an expert in cost effectiveness analysis. So he'll be presenting that at the American Heart Association as a late breaker, and then I'll be presenting REDUCE-IT USA, the large pre-specified subgroup from REDUCE-IT of people who were enrolled in the United States. So there'll be those two new pieces of information coming out about REDUCE-IT at the American Heart Association, and by the time we get to CMHC West, both of those should be really ready for re-presentation, maybe even published by that time. So it'll give us an opportunity at CMHC West to really get into the data and discuss it, and maybe there'll be even other analyses by then, who knows. Beyond just the REDUCE-IT related aspects, I think there's going to be other important updates. There's all sorts of activity going on in terms of diabetes drugs being used for heart failure. I think there'll be lots more subgroup analyses presented from some trials like DAPA heart failure that showed a benefit of SGLT2 inhibition in patients with heart failure with reduced ejection fraction, regardless of whether they have diabetes or not. I think there's going to be important updates in the antithrombotic world, whether it's strategies like what we studied in THEMIS and THEMIS-PCI of aspirin and ticagrelor in patients with diabetes and stable coronary artery disease, or the COMPASS-like regimen that is low-dose rivaroxaban plus aspirin. There's analyses that will be coming out between now and CMHC West that I think will be very relevant to people that are caring for patients with cardiometabolic disease. So that's just a sampling of some of the things that I anticipate that'll be interesting, exciting, potentially practice-changing between now and CMHC West that we'll be able to cover in 2020 at that meeting. So even if you've come out to CMHC in 2019, I'd say come back for CMHC West in 2020.